Hi, I'm Dr. Tori McJunkin. I am an interventional pain physician, and I'm going to talk to you about headaches today. There's a couple different kinds of headaches that I want to cover. One of them is migraine headaches, the other is tension headaches, and then another would be considered referral or referred headaches. So let's talk about those different kinds of headaches. This is to help educate you about those headaches and then hopefully help you seek treatment for those headaches too. Migraine headaches are more common in women typically than in men. Tension headaches are also more common in women than in men. About 90% of people will experience tension headaches at some point in their life. And tension headaches are those headaches that are usually related to stress. Usually, stress or anxiety are the main triggers for tension headaches. Typically, when people have tension headaches, they experience pain either over their temples and the front part of their head or in the back part of their head here. And sometimes people describe it as a vice like sensation or tightening or stretching. They can be typically mild to moderate in severity. Usually, like I said, they come on after stress, they continue to get worse, and they stay usually at that moderate level of severity. They can last anywhere from a couple of minutes all the way up to hours and hours, and sometimes even days and days, although that is a little bit more uncommon. Typically, when we talk about tension headaches, we talk about the muscles being really tight. And so it could be these frontal muscles that are tight, the neck muscles that come up in the back here. Sometimes even the front of neck muscles here will be really tight and cause those headaches to occur. For migraine headaches, it's a slightly different story. Typically, those are more moderate to severe as far as how they affect you, the pain that's experienced by somebody with those kinds of headaches. It can be unilateral, meaning it's just on one side, or it can be on both sides. Oftentimes it's related to the eye as well, and so people might have pain that is directly surrounding the eye. The interesting thing about migraines is some people will experience aura, and what an aura means is you know when the headache is going to happen before it happens. So you might experience, some people will smell something, like a burning type smell or something like that, and then they'll know, oh geez, I'm going to get a migraine headache. Some people will also see stars or flashes of lights or something like that, and those might be their aura for having those kind of headaches. That's called classical migraines. Common migraines, typically people don't have aura, so they don't know that they're going to have the headaches beforehand. When we talk about migraines, we talk about triggers, and those are the potential things that cause those headaches. So it can definitely be stress, like we talked about for tension headaches, but there's a whole slew of other things that can be triggers for migraine headaches too. One of the things could be certain foods, certain drinks. Some people talk about wine, cheeses, those kinds of things can cause those. Each trigger can be different for each person who experiences migraines. So that's one of the really important things. If you experience migraines, it's really important for you to keep a journal, a migraine journal, where you're really tracking what are the foods that I ate, what are the activities that I did, how did I sleep? Sleep is another thing. If you don't sleep well, that can trigger migraines. Or if you're exhausted, if you're malnourished, if you're not drinking enough fluids. So everybody, can be a little bit different in how they experience those migraines, but they could be so severe that it's important for you to figure out what the triggers are to try and prevent those migraines from occurring. So one of the things I always recommend is a migraine or a headache journal. So you might write down how you slept the night before. You might write down, what you ate, what you drank, how stressed you are, those kinds of things in relation to your migraine. And then you might write down where the migraine affected you, if it was on one side, if it was both sides, if you knew beforehand, like if you had that aura sensation. Those things would all be fairly important when you're writing down and keeping a headache journal to know whether or not, what the triggers are. And hopefully you can avoid some of those triggers and prevent yourself from having those severe migraine headaches. Whenever you see a physician like myself and talk about headaches, there's a couple different things that we want to think about. One of the things is we want to see what kind of a headache you have. The last two kinds of headaches we talked about are really common kinds of headaches. There are some other referral type of headaches though that can occur. One of those can be the little joints that are in your neck. Those are called facet joints. Those can refer headaches up into this area. We talked about occipital neuralgia or occipital headaches. Again, there's nerves back here that can shoot pain up and over. Sometimes there's nerves that sit above the eye, below the eye, that can cause pain up above. And then, of course, we want to make sure that there's nothing really serious, nothing severe. So really high blood pressure can cause headaches. Obviously things like tumors or fractures and those kinds of things can cause headaches. So one of the first things you do when working somebody up is you want to make sure that they're not having a really bad headache from something else. So oftentimes we'll talk about getting MRIs, and oftentimes we'll get an MRI of the brain to make sure that there's nothing else going on that's causing the headache, nothing else severe that would require any kind of urgent treatment. Oftentimes when I look at people with headaches, I'll often consider the neck as a real likely source of headaches. And there have been some studies that show around 30 to 40% of headaches can be referred from this area in here. So I think it's important to look at the neck, whether it be with an x-ray, or I often prefer an MRI because you can see so much more anatomy with the MRI. One other thing that you might consider is whether or not you have nausea with your headaches, and that's something that you can write down in your headache journal. If you have nausea or vomiting with your headache, that can sometimes be normal with migraine headaches. You typically don't see that with tension headaches. Sometimes you'll see that with other types of headaches, especially the bad kinds of headaches where you're thinking about, is there a tumor or is there something else strange going on? And that's what an MRI would look for. But sometimes with increased intracranial pressure or pressure inside the skull, you can have nausea and vomiting with those types of headaches too. And so I always recommend to people, if you have these severe types of headaches, especially if the headaches are new, it's important for you to work that up. So you want to think about getting MRIs, you want to think about seeing a doctor. And then even if they're not new headaches, if this is a problem that you suffer with, then I think you really owe it to yourself to seek medical treatment, whether it be with medications, relaxation type therapy, seeing the chiropractor, acupuncture, any of those kind of things can be beneficial, massage therapy, or seeing an interventional pain doctor. There might be some procedures, interventions that we could do that would really minimize the headaches that you have. I hope this really helps you out. Thanks a lot.